And a very good evening, everyone, and thank you for joining for this media briefing. We will be addressed this evening by the Attorney General and Minister of Legal Affairs, the Honourable Dale Marshall, the Senior Medical Officer, Dr. Ingrid Cumberbatch, and Head of the COVID-19 Monitoring Unit, Mr. Ronald Chapman. We will start with the Attorney General.
Good evening, all. Thank you very much for your introduction, Lisa. It's been a while since I've been able to share with you, the press, on one of these briefings. That is not to suggest that there's anything out of the order, but I feel it is important that I come along this evening just to clarify a few things. Now, yesterday, the Prime Minister, in her address to the country, set out essentially the various changes that would be implemented as of midnight tonight. You will know that we have a current directive, but because we have taken a decision to change some things midstream, that current directive is being revoked and the new directive will be in effect from midnight tonight for a 2-week period. The Prime Minister met with the Cabinet COVID subcommittee this morning, and we were able to refine a few of the measures that were discussed by the Prime Minister yesterday with the country. And for absolute clarity, I think it is important that I join you for a few minutes this evening to try to make sure that we are clear on the refinements. The first thing that I want to home in on is the churches. You will know that the decision has been taken to limit the number of attendees at various church events. Of course, by churches, we're including all religious denominations, all sectors. Essentially, any church activity is limited to 25 people. But of course, you will know that in discussions since we started this shutdown process, we've had conversations with various congregations, some big churches, some small churches. And one of the things that is fairly clear to us is that we run the risk of not achieving what we really want to achieve when we adopt a one-size-fits-all approach. At this point in time, but I suspect this will be the last time that we do it, we have decided to limit all churches to 25 members, 25 attendees. But we recognize that there are some very small church buildings that have active congregations. Now, the paramount thing about the church attendance is that regardless of the ceiling of 25 people, you will not be able to operate in anything other than 6 feet distance between you. Now, in a very small congregation, in a very small church building, a 6-foot distance between each member, each attendee at the church, could well see no more than 14 or 15 people being permitted to attend service. And I want to make it clear that is exactly what we're trying to achieve. There have been some fairly loose interpretations in the past where people have said, well, you've limited me to 25, so I am having 25. Never mind that my building can actually only hold 10 or 15 people when you follow the 6-foot distance. I want to make it clear that we are limiting the maximum number to 25 persons, but in those very small church buildings, those churches will actually likely have fewer people, simply because the paramount indicator is going to be the distance between the individuals. The Prime Minister and the Minister of Health will be meeting with all faith-based organizations around the middle of the coming week. And it is expected that at that meeting we will be able to discuss in great detail the various ways in which congregations can meet the minimum COVID requirements, keep themselves, keep the members of their congregations safe, while allowing for differentiation between churches based on sizes and so on. We've already begun to get some feedback. I'm not really at liberty to go into what the structures might look like, but I want to make the point that we will be dealing with churches not in a one-size-fits-all approach as we have in the past, but we propose to be looking at individual churches, individual congregations, to try to see going forward how we could come up with a normative arrangement that will satisfy the needs of the church, but also the paramount needs of the country for safety in a time of COVID. The other matter that I want to refine somewhat relates to the physical activity side of things, the exercise side of things. The COVID subcommittee has determined, and the Prime Minister has accepted that recommendation, that aerobics and dancercise activity, classes in those two areas, must be conducted in an outdoor setting. So you will not be able to do aerobics classes or dancercise classes within a building. Those things must be done in an outdoor setting, and I hope that Mr. Chapman may be able to, if required, to go into some more details on that score. We also want to stipulate and have stipulated that gyms, dance, and other exercise studios will be continued to operate, but on a case-by-case basis, they will have to operate based on specific protocols that will be published by the COVID monitoring unit. And we've asked the COVID monitoring unit to try to determine what those protocols are going to be within the next day or so that I imagine that by the start of the week, Mr. Chapman and his team will be able to say, for each specific entity, whether it's a gym or a dance studio, these are the protocols that are going to be in play. The Prime Minister has already signed the declaration, the current directive, and as I said, this directive will come into force as at midnight tonight. So all of those people who are wondering what the congregation size can be tomorrow, it's going to be 25. All those who are wondering about the dance size class, from tomorrow, it has to be outside. Lisa, I think those are the comments that I'll make at this point in time, and I'll be available for questioning afterwards.
General. Well, as you know, Barbados recorded yet another spike in cases, and Dr. Ingrid Cumberbatch is here to explain a little bit about the statistics regarding those in isolation. Dr. Cumberbatch?
Good afternoon, Barbados. This afternoon, I am not going to give you an epidemiological report, but I'm going to give you a little bit more information about the numbers that you have been seeing on the dashboard. I, however, have to begin by sharing with you some sad news. I'm extremely saddened to have to announce the death from COVID-19 in the early hours of this morning of a 58-year-old lady who was in isolation for about 8 days. She had no comorbidities and was not vaccinated. On behalf of the Ministry of Health and Wellness and the Government of Barbados, I would like to extend sincerest condolences to her family, friends, and loved ones. In starting to look at our situation, I will begin by giving an update on our new cases detected for August 27th. There were 1,699 tests conducted and 92 new cases, of whom 42 male and 50 female. The number of deaths from COVID-19 are now 49. This is the first death since July 8th this year. Taking a closer look at the statistics for August 25th to August 27th, and I believe that these will be shared with you on the screen so you can see what I'm speaking of. For August 25th, we had a total of 21 cases. 7 of these were aged less than 18, and 14 were over age 18 and over. And for the 18-year to 65-year age group, there were 13 persons. 1 person was fully vaccinated, and 20 persons were not vaccinated. 2 of these cases were related to travel, 12 were symptomatic. And in terms of the percentages, you can see that for the persons aged less than 18 years, that was about 33% of the total cases, and 67% for the ones 18 years and over. For the fully vaccinated, we had 5% of persons who were fully vaccinated who had new infection, and we had 95% of cases who were not vaccinated. For the 26th of August, a similar picture was seen, where persons who were aged less than 18 years were 8 out of the 48, and those aged 18 years and over were 40, representing 17% and 83% respectively. The fully vaccinated were 7, and the non-vaccinated were 41, representing 15 and 85%. So what are we seeing? More children are being infected and ill with symptoms. 4 out of the 7, 57% of the children on August 25th, and 4 out of 8, 50% of the children on August 26th. So Barbados, if you are sick with the cold, sinus problems, flu-like or other symptoms, including diarrhea and or vomiting, do not stay home sick. And certainly do not go to work or take your child to daycare. Go to the doctor and go and get a COVID test. Know your status and protect your loved ones. We can see for August 27th that the trend continues and is increasing, because you can see that the persons aged less than 18 years, the 26 of them, of the 92, representing 28%, were infected. And those aged 18 years and over, 66, representing 72%. So for that period, we had a total of 161 cases, 41 persons being aged less than 18 years, representing 25%, and 18 years and over, representing 75%. You can appreciate that persons are still working on the ground, the contact tracers, who are gathering information about for August 27th, so that data is not complete. And I want to take this opportunity again to encourage all Barbadians to please cooperate to the fullest extent with your contact tracers. They are working to help you, and they're working to help the whole of Barbados. So be as cooperative as you possibly can. The lower part of what you would have seen was just pulling out the persons who had traveled. And I just did this so that you will see that the numbers from travel were so minuscule that it really did not impact the percentages significantly of the picture that we have seen here from the 26th to the 27th. It is clear that the majority of persons who are being infected are unvaccinated. 95% on August 25th and 85% on August 26th. We are seeing entire families and households being affected. On August 25th, there were 3 families ranging from 2 to 3 persons. August 26th, 6 families ranging from 2 to 5 persons. August 27th, we know at 13 families ranging 2 to 6 persons. I don't have to say much more. We know that the risk of spread in families is real. And given how we as Barbadians socialize and live, this is even more of a reality. Because we have our core families, and then we have the extended families, many of whom are have vulnerable persons, such as elderly, persons with chronic diseases, and those who can't yet be vaccinated, such as very young children, because there's no vaccine available to them. I have presented the evidence to you. And again, I will encourage you to reduce the risk of spread amongst your families and other vulnerable loved ones by adding that additional layer of getting vaccinated. I will even put it to you that even though you may be going to a household that you go to often, but you don't live there, wear your mask, because that is a layer of protection for you and your loved ones. I visit my mother's house often, and she's an elderly lady and fully vaccinated, but I wear my face mask. I'm sure she's saying, why is that girl calling my name? We need to think about what we are doing, but sometimes, not sometimes, but all the time. It is not easy, but we need to make the effort, because these are the things that are going to reduce the risk to ourselves and to others. We need to protect our vulnerable ones. On a base of ensuring that we have a balanced diet, exercise routinely, and increasing our vitamin C and other supplements, herbal or medical, to keep our immune systems in good working order, because there's a foundation that we need to build on. Remember the layers. Hand hygiene, which is the hand washing and sanitizing. Proper wearing of face masks to cover both your nose and your mouth. Physical distancing. And we have vaccination. Your choice, Barbados. You need to decide what layers you're going to use and how many. But me, I want to have the greatest protection, so I'm going to use as many layers that are available to me as possible. And I encourage you to do the same. Thank you.
Thank you, Dr. Cumberbatch. Mr. Chapman will now speak about the measures which must be enforced.
Good evening, Barbados. This afternoon we had the unfortunate occasion of hearing of a death in Barbados. This is not something we want at all. So what I want to do this evening is to take some time to talk about the areas of significance where we find COVID-19 is spreading. What is happening in Barbados is that we've been getting a lot of persons becoming ill in two main categories of areas, what we would call recreational areas and areas of work, occupational. So what is happening basically is that we as a country, as we feel comfortable with one another, as we feel as though we become familiar, we tend to drop our guard. So we are finding that COVID isn't spreading in the front office of the stores and supermarkets and so on. When persons interface with staff and interface with customers, there's the hand washing, there's the physical distancing, there is the hand sanitizing, the temperature taking. All of these protocols are in place, and we're not seeing persons become ill. What we're seeing is in the back offices, in the storerooms, in areas where the staff congregate, have lunch, where they take off their masks, where they sometimes we having instances where staff decide at lunchtime they're going to go into the car with one another and eat lunch. These issues where people congregate close together are causing us significant concern. As you have heard, we've been having issues with churches, and this has to do with the same issue: close contact, confined spaces, and crowds. And once you have those three C's come together, you're going to get COVID. You increase your chances of getting COVID. We've seen the bars where persons come together, and as the Prime Minister was saying that you can go ahead and have your drink and so on, but try to do it outdoors, because what tends to happen is as people have a couple drinks, they tend to drop their guard, the inhibitions lower. And as the inhibitions lower, they come a little closer to one another. Sometimes there's an argument, a friendly argument, and the voices rise and they argue and so on. And these conditions predispose you to becoming ill with COVID, I should say catching COVID if someone in the crowd has it. And with the high transmissibility of the Delta variant, it is significant, it is important that you are aware. Situational awareness is going to be key going forward. Be aware of those who are around you, that they don't bridge that space, that 6 foot distance. And if they do, they must have on their mask. Be aware of those around you. And one of the things I wanted, Dr. Cumberbatch spoke about, if you're feeling as though you're catching the cold, go get tested. If you're getting bad feels, and you know you're having diarrhea and so on, go get tested. There's no cold stirring in Barbados right now. So if you're coming down, your throat feeling scratchy, and you think you're coming with a sore throat, please don't go to work. Go get tested. Specifically, what can we do to be able to address these issues? The first thing, as we said, and we keep on saying, wear a mask. If you're going out to a bar and you're having a conversation, when you're talking, put the mask on. When you're going to take the drink, lower it, drink it, and put it right back up. It may save your life, or it may save the life of someone close to you. The tendency is that you see people, persons in bars, and you walk into the bar, and this is how they're wearing the mask, under the chin. This is not the appropriate way. This exposes you. Avoid crowds as much as possible. and I don't know how much I can stress this, avoid crowds. Delta variant is highly transmissible, and it's important that we avoid crowds. We maintain our physical distancing. If you're going to go to your bar, go to your barber, you're going to a hairdresser, make an appointment. You can sit outside in the car or under a tree or somewhere until the area is free of other persons, then you can go in. Especially if you're going over to visit other people's homes, wear a mask. If someone is coming over to your home, have them wear a mask. We're in a place where we can play now. This thing is extremely serious. Wear your mask. Keep your hands clean. Wash them. So, and more than anything else, we're encouraging persons to get vaccinated. Please. It is one of those additional layers. There are a number of concerns, and as I said, you would realize that the change in the directives work towards reducing crowds, reducing contact, and reducing persons in confined areas. So we want to be able for us to understand what we call the mischief that we are trying to address. Please let us follow the protocols. We see clearly that where protocols are being followed, people aren't getting sick. As I said in the beginning of my talk, in the front of the supermarkets, in the stores, and so on, people aren't getting COVID because everybody is keeping their distance. They're doing everything that they're supposed to do. It's at the homes, it's in the back offices, in the storerooms, it's in the lunchrooms. It's around those people that we feel comfortable and secure around. That is where we're having the issue. So I just want to ask persons, maintain the protocols. Be aware of your situation, be aware of those around you, and if they don't have on the mask, just kindly ask them to put it on. If they don't want to, move away. If you come across any instances where there are large crowds and so on, please report it to the COVID-19 monitoring unit. The number is 536-4500. That is the hotline. You can get us there during that is the hotline. There are persons at the hotline who will be able to take your concerns. 536-4500. And we at the COVID-19 monitoring unit will respond. So again, please be situationally aware and take care of yourself. Thank you.
Thank you, Mr. Chapman. Now, as we open for questions, I'll just ask members of the media to identify themselves and the media house they represent before posing their questions.
Hi, good afternoon. Corval Muncie from Nation News. Just a quick question for Mr. Chapman. Given the exponential nature that the Delta variant spreads, can you tell us if your unit has the adequate manpower and resources to keep monitor do the necessary monitoring for what we are grappling with at this moment?
What I can say is that in a role such as ours, you can never have enough. And the reason I say that is because the Royal Barbados Police Force has probably over 1,400 officers, and there's still crime. Why I'm saying that? I'm trying to say this, that Barbadians need to be able to take responsibility for themselves. The COVID-19 monitoring unit is well staffed and is well able to address the issues that we are confronting. But we can't be everywhere at once, and we as a country need to realize that this is not only an individual effort, this is a family effort. And persons must spend some time recognizing that they must take care of their own issues and take care of their own safety.
If I can add to that, Mr. Mumsey, in the short time that we've been here, I've already got 2 reports sent to me from extraordinarily reliable sources pointing out 2 instances and asking that they be looked into, and I'm not at liberty to say what they are in this way, but they demonstrate, these 2 instances, if the reports are factual, that Barbadians are not taking the directives and the protocols seriously. And in those circumstances, if we had 10 COVID monitoring units, we would still have a problem with policing. The monitoring unit is certainly doing the best that it can. In many instances, the police are then called in to back up because they don't have the power of arrest. They will go in and they will investigate the situation, and they will bring charges. But often, in terms of causing the event to stop, they have to rely on the members of the Royal Barbados to police to actually come in and to supplement that effort. So the 2 points I'd like to reinforce would be that Barbadians are continuing to be scofflaws when it comes to the directives that they have to follow. And in those circumstances, we could never have enough people to police. And secondly, irresponsible behavior then puts a greater strain on our national resources, because then the police have to stop dealing with what they're dealing with to come and back up the COVID monitoring unit. And that has nothing, of course, to do with the health risks. So Mr. Chapman is right, we can never have enough, but certainly I'd like to commend them because they're doing a marvelous job in the circumstances at great personal risk to themselves.
Hi, Kezia, Ennis, Starcom Network. That being said, what is the latest update on people who have been found in violation of the protocols and had to be brought before the law courts?
Okay. Actually, what I was there looking at my phone is the last report that was sent for me for last week. We had a number of breaches. In fact, we had a total of 20 persons court cases that were adjudicated. There was one breach of curfew, one quarantine breach, 6 persons attending an event that they shouldn't have. In fact, there are 11 of those, 3 non-wearing a mask, and 4 failing to places remaining closed. And this is an older case. Of those we've had, let's just make sure I have the precinct. We had 9, 10, 11, 12, 13, 14 of those being found guilty, and the other 6 there were 4 not found guilty, and the others are still before the law courts. And those persons, the fines range from $300 to $1,000. I think there are about 7 or 8 persons who would have been fined up to $1,000, and there were 2 who were fined $1,500 apiece. So the unit is still doing its work. It's doing its work very quietly in the background with reference to court cases. I think one of the things that we have to do is to make this available, this information available to the press, so that others who would want to flout the protocols would understand that there are consequences, and the consequences are not only COVID, but they're legal consequences. We don't like doing this sort of thing, but we would prefer that persons adhere to the protocols.
Related to any of the events on Crop Over Day, which would have been under investigation?
As I said, I'm now looking at the report on my phone. I can't say exactly which ones there are. I have the names of the persons, but the actual event I do not have. There are a number of cases that go back before us. Some of those cases have been heard and settled before the law court. I would have to check specifically for those, but almost every week there are cases before the law court.
Follow-up question on that same vein for the Attorney General. Given the fact that, and by your own statement, that persons are still flouting the regulations, the deterrent factor, I mean, the penalties attached to these directives, do you consider that they may need some revision at this point, given the gravity of what we are going to be facing going forward, sir?
I don't think that the penalties require any changing. By now you would know that the maximum penalty is $50,000 or imprisonment for 1 year. That is a fairly stiff penalty. It is one that has that our courts have not taken anyone to the extent of that penalty being imposed, but we have had some fairly stiff penalties being imposed in the past. I think some fines have gone certainly $6,000 and $8,000 and $9,000 and $10,000. But the issue, and I have to keep repeating it, when a matter goes before the court, the penalty is determined by the judge or the magistrate on that occasion, based on the severity of the offence and also based on any mitigating factors that might arise. So I am not in a position to say anything negative about the penalties that were imposed, but I can say that the maximum penalty, $50,000, is certainly a significant penalty. The maximum penalty of a year imprisonment for COVID violation, that is also a significant penalty. And I don't think that there's any reason at this point in time to consider increasing the severity of the penalties that are available to the law.
Next
I am
question.
from CBC.
Go ahead,
Go
Ryan.
ahead, Reem.
And I'm not sure if the AG is best to answer this question or Dr. Cumberbatch. Given today's numbers, I believe 92, and the numbers that we've been seeing in the more recent days, I know that there is an intention to set back up Blackman Gullup. Is there any consideration to having to set up other facilities outside of the ones that might have been mentioned even yesterday, with a belief or possibility that we may have to go beyond numbers that we would have seen within the last year?
I can say that the stance of the Cabinet COVID subcommittee and the stance of the Ministry of Health is to ensure that we are prepared for any eventuality. At every meeting that we've had, we've been discussing if this, then what? And we paid a great deal of attention in today's meeting to trying to determine what facilities we have, whether they're adequate, and what further facilities we should have in the pipeline. I don't know if Ingrid would like to give more specifics from a medical point of view, but as a member of the COVID subcommittee, I can say to you that these matters are absolutely always under review, and we are making sure that Barbados is in the fullest possible state of readiness for any eventuality as far as COVID spikes go. Ingrid?
That is correct, AG, because we have been working for a little while now with a surge plan, and as AG would have said, the meeting of the Cabinet Subcommittee, we are looking at all elements in terms of not only isolation, but quarantining, because you know that part of our plan, or what we have been doing all along, is the quarantining of the hotel quarantining of our primary contacts. So we have been building capacity in those areas, and we are looking at that continuously. Thank you.
Ryan, did you have a follow-up?
I actually did just one. Given the numbers, Dr. Cumberbatch, that we're seeing of those under 12, and the fact that you said that we don't have a vaccine, obviously for that age group, what is your recommendation under these circumstances? In those, I mean, beyond just what we would call the protocols, in terms of how people should move family-wise, because it's a sensitive area. You know, you have little ones. How best should people operate, whether or not the symptoms are coming from the little one or somebody else in the household? Really.
Thank you very much for that question, because it gives me the ability to enforce something I've said before, and that is that we have many layers, and the final layer is vaccination. And if we get as many persons as possible vaccinated, then there's something called herd immunity, because it protects those persons who can't be vaccinated for whatever reason. And if you don't have persons in the community for the infection to spread to, then it can transmit in the community. So if we have as many persons vaccinated as possible, then it gives an added layer of protection to those vulnerable ones who cannot get vaccinated because there's no vaccine available at present. So the key is to get as many persons vaccinated as possible. And I know some persons may say to me that, yeah, even though you're vaccinated, you can still get disease. But the important thing with this thing that we're fighting is that, yes, you can get disease, but we don't want severe disease that can put you in ICU and put pressure on the healthcare system. And we also don't want people dying. That is the main thing that the vaccine is supposed to prevent from happening.
Anesta?
Good afternoon, Ernest. Good evening, sorry, Ernesta Henry Barbados today. Dr. Cumberbatch, can you speak to the state of the children? You're saying that more children are becoming ill. Can you speak to the condition of these children?
I can't give you any exact details. Dr. Ford would have to give you those details, but I can tell you that many of them are presenting with symptoms, about 50%, as I would have showed you in the data that I would have presented before. And that is significant because when persons are symptomatic, that means that their risk of spreading the disease to other people is higher. So yes, the children are sick, but the amount of sickness that we're having at present, I don't believe, but I stand on the correction from Dr. Ford, is that significant at present, as in they're not requiring ICU. I don't think he has any children in his ICU at this point in time. But if we look at what has been happening in other jurisdictions where they've had Delta and where you see the significant amount of children, one, that are ill, and two, that are severely ill, requiring ICU care, that is a place that we don't want to go.
I have one question for the AG. AG, I've seen it in some other countries. I've even heard US President Joe Biden speak about it more recently. It's not something that I've seen here other than perhaps the private sector. This whole thing of incentivizing vaccination. Mr. Biden has talked about literally giving people money perhaps to get vaccinated. Some Caribbean countries, they've had land lotteries. I've seen one with actual money lotteries. Is that something that government has considered in our situation to help push the numbers, even though we've been seeing good numbers since Pfizer started? But is that something that has been considered to help move those numbers along even more, or is that not a consideration?
It certainly is something that we are aware of. And I know that the approach of the Prime Minister and the Cabinet COVID Subcommittee is that we will do what is necessary. But we have not at any time given the issue of incentivizing any specific consideration. I quite frankly think that the best incentive is a long life and good health. And based on the interest in being vaccinated that I think we've seen in Barbados, and also based on the numbers that we've seen coming out so far since we've had the Pfizer vaccine, I think that Barbadians are seeing the incentive that we want them to see. I don't therefore think that we are in any place where we need to think of offering individuals any monetary or any other kind of benefit. For us, being vaccinated means keeping our businesses open, keeping our people healthy, and being able to function as a whole, properly running country. So at this point in time, good luck to those nations and those entities who feel that it is necessary, but I don't think that we are at that place.
Next question.
Final question from me for Dr. Cumberbatch. Could you give me an idea of given the fact that we're having younger kids now infected with the virus, and perhaps the more virulent strain of the virus, what's the risk assessment for Miss C at this moment, and what exactly are the measures being put in place at this moment to counter?
Of your question, you said what is the risk for Miss C?
The risk assessment for Miss C at this moment. What are the concerns that you're having at this moment with regards to our kids coming down with that that issue, that more complex issue?
I I'm not certain that I'm fully understanding your question. But if you're asking me if what is the risk of persons or the children getting infected, right? I can say to you that the risk of children getting infected is the same risk as for anyone else. Because once the disease is spreading out there, and we know that with Delta don't have no respect for no one. Delta takes out entire families quickly. So the risk for the children are the same. Because especially, as I told you before, when we are in households and persons in households, we know our living situation. We know we have close-knit family units, and we also know that our home, our social situation in homes sometimes can be a bit overcrowded. So that is all very much in keeping for ease of risk of spread among children and adults, if that answers your question.
No, not quite, Dr. Cumberbatch. When I'm saying Missy, I'm referring to the multi-symptom inflammatory syndrome, and obviously we have had one case already, and I'm trying to ascertain what's the risk assessment in that regard.
So what I will have to say to you is that I am not fit at this time to ask that question. I would have to put that question to Dr. Ford. Dr. Ford would better be better placed, or the pediatrician would be better placed to ask that question to you. But I can say to you that like any other side effect, it is possible that it can happen, especially given that we've had one before.
Are there any further questions? Sorry.
Dr. Cumberbatch, we've had 40 plus cases reported yesterday. We are in our 90s today. If we continue on this trajectory, what are we looking at next week? Can you paint a picture for Barbadians, please?
My picture painting can only be in relation to projections that we would have had from UWI, who would have assisted us with looking at a mixture of having alpha and delta based on a R0 value, I think about 4.5. And they gave a projection of having a maximum 500 cases a day. So we haven't seen that yet, but we know that that is a possibility. And from looking at other scenarios, we also, when I say other, I'm talking about in other jurisdictions, we know that that is not even the worst case, because that was a picture that was painted with a mixture of alpha and delta circulating in Barbados. So right now, given the projections from our UWI colleagues, I can say we're looking about 500 cases a day in right now, probably into next week, as a maximum.
Are there any further questions?
I have a question for Dr. Cumberbatch. During the town hall meetings, the recent town hall meetings on vaccinations, the CMO would have indicated that there were 1 or 2 deaths that could have been linked to the persons taking the COVID vaccine, and yet indicated that these deaths would be investigated. Is there any update on these investigations? Has there been an outcome from the investigations as yet?
I have no update to provide at this point in time.
Is there a follow-up, Kezia?
No, that's it. Thank you.
Okay. Well, at this then I will thank the Attorney General, the Honorable Dale Marshall, the Senior Medical Officer, Dr. Ingrid Cumberbatch, the Head of the COVID-19 Monitoring Unit, Mr. Ronald Chapman, and you, the media, and you for watching. Good evening.